The next speaker is a fantastic, incredible physician, dentist, surgeon. You know, Bob or Robert Glickman, he's the Associate Dean for Clinical Affairs, but he's also the chair and professor of the Department of Oral and Maxillofacial Surgery. Now, he solves every dental problem and any bone problem that is above the neck in patients with FD. And in addition to that, in addition to the incredible dedication and knowledge, he has now opened a fantastic center of dental health for people with disabilities. And, you know, I always joke that many times we need to convince other doctors, and a big part of our job is to convince doctors to see people with FD, not to be scared, to tell them we'll support you. And these patients are incredibly interesting. Not only they are great human beings, but they are also very interesting from a medical point of view. Now, in the case of Dr. Glickman and his center, it's exactly the reverse. We don't have to convince him. He's the one that says, we have a center, we want everybody with FD to come and see us. So he's going to talk about that. Let's give him a warm round of applause. Dr. Glickman, thank you very much for being here, and take it away.
Thank you, Dr. Kaufman, for those very humbling comments. I do have to admit that, and my error, but I have a partner here, Ron Kosinski, who's the clinical director of the center, and we want to take the opportunity, really the privilege, to speak with you for a few moments about the Oral Health Center for People with Disabilities and the context which we think fits so aptly. I might point out that for the past 20 years, the dental faculty practice was actually adjoining the FD Center at the Med Center. We just recently moved to 41st Street, which is one of those two-edged swords. But for over 20 years, I was involved with the care of those patients. But by contrast to what Ron is going to tell you, my experience was in the emergency room, in the operating room in the middle of the night, under the worst scenarios or case types that you can imagine. And really what the center is all about, and what Ron is going to explain, is really the opposite of that kind of care. We want to create a dental home not just for the present, but imagine what happens when one's caregivers move on. Who is going to take care of our families when that happens? And that's kind of the essence of what this is all about.
Thank you for having me. So I think what we were able to do here is, from the beginning of this design process, we were able to build a center where initiate a culture change and a paradigm shift in the way that dental students, we train about 10% of the nation's dentists at NYU. So it's being the largest dental school in the country. I felt like the dean had a vision, and I thought that we could bring that vision to fruition. And the way that we're doing it is we're really initiating a culture change in the way that the largest dental school and the students approach this patient population, or the patients with disabilities, and changing the way that they embrace this patient population. It's really very necessary that this change, this culture change occurs. And I think that what we're seeing is that from NYU Center, we now have centers being built at University of Pennsylvania, in San Antonio, and in other areas of the United States. And I think that this change will resonate throughout the country. And I think that what we're going to see is the change instead of pushing people to go to sleep, and instead of making people, putting an IV in their arm, we're going to change the way that the dental population addresses patients with disabilities, especially patients with FD. I've had the pleasure of being able to treat an FD patient for about the last 25 years. Stephen Wexler has become part of my career, my life. It's been a wonderful opportunity to know the Wexlers and to enjoy the opportunity to treat them and to learn much about the disease. It's truly an honor for me to be able to say that I've know the disease process well, and the research that's being shown is stunning. I think it's amazing to see what's going on, and I look forward to seeing much more.
I'm sure many of you have been to dental offices, and you'll see the dental office configuration, the size of the operatories, the equipment that's there. really isn't geared to treating patients who come in with myriad forms of disabilities, wheelchairs, for instance, healthcare workers or support people that are helping them. And you'll see as we go through some of these slides how we've addressed those issues. It's not that people with disabilities didn't have any access to dental care. It's just that now the technology allows us to raise that level up several notches. Again, just a list, nothing new here. Everybody's very familiar with what the possible things are. I don't want to spend too much time on that. But in this area, notwithstanding what Dr. Kaufman just presented, there's almost 1 million people have some form of disability. And you can see what the percentage of that is. There's about almost 100,000 people who maneuver in wheelchairs at all times. About the wheelchair, some of the most critical times for somebody in a wheelchair, of course, is the anxiety of being moved from the wheelchair. So some people can't easily be lifted out of a wheelchair safely into a dental operatory, and that is a moment of probably extreme anxiety for them. Again, if you wanted to look at the different types of disabilities, I don't think that part's most interesting. And we do want to get to, at the end of this little presentation, if there's any questions to it. But you can see, Ron, did you want to just mention a couple of these things?
Sure. So, it's interesting that the people are afraid. This dental students that you see that I've encountered with are basically afraid of the disabled population, and we want to change that culture, and we want to make them understand that everybody's the same, that we all have 2 eyes, 2 ears, a nose, and we all breathe the same air. And I think that through this building in the center, we're beginning to see that, and it's so interesting to watch in the 3 months that we've been open, to see the shift that's occurred in the way that students are approaching this patient population. We have patients, we've implemented some changes. We have a multi-sensory room similar to your happy room. And what we've done, the dean introduced me to, Charles had introduced me to the Tandon School of Engineering. And at that time, there's a project called the Ability Project there. And what I've learned through this is that we've developed in the multi-sensory room, we've developed our own adaptive technology because we have so many resources available to us at NYU. So we've been working, the dental students have been working with the engineering students who have been working with the Steinhardt School of Occupational Therapy and some of the Tisch students to create adaptive equipment in this multi-sensory room that we'll show you some of the things that they've done. Most recently, what we've done is the dental students are now taking impressions of people's hands, and we're making digital adaptive toothbrush holders, the students, so that people with disabilities can hold on to a toothbrush easily with a printer, with a 3D printer. So we're making, that's the kind of technology, the kind of amazing things that are occurring with the silo being removed from dentistry and being able to envelope in so many other different professions within NYU. So for me, the center has been wonderful, but what I've seen here is the integration of so many wonderful collaborative abilities and technology to be able to do some special stuff here at one of the largest universities in the nation.
Ron's the passion of the center, and I'm in charge with the bottom line. And with that, you'll notice the bottom line here talks about sustainability and financial aspects of it. A center like this, then we'll show you a little more, nice pictures in a few moments. How is it sustainable, since patients with disabilities tend not to have the utmost in financial support, because the model is in a dental environment where we're have a large tuition model of students paying tuition, we're able to sustain it, and therefore the actual cost of things is very reasonable for us to do it in that environment. I hope no one in the room presently has had this experience, but when care occurs in a hospital environment, it's not a top priority for a hospital. OR time is very difficult to get, the equipment is not easily accessible, and individuals who can deliver the care are not readily available. So you can see, even on a planned basis, these things tend to really go from emergency to emergency, and not trying to prevent things from worsening. My work with Dr. Kaufman now recently has developed, treating patients in an ambulatory setting to avoid these emergencies. But my experience is very jaded, because that's how I came to know the center and know the people in the center. Some of you may or may not be aware, but our dental college on 24th Street is the largest dental center in the United States, if not the world. As such, We're nicely situated in a great metropolitan city. We do have, as I said, a viable financial model, and we took over 3 years in order to put this all together. Our dean, Charles Bertolami, had a vision, seeing somebody navigating the streets of New York in a wheelchair, and he said, gee, how do they obtain their dental care, their ongoing oral health care? And talking with partners in medicine and industry, a white paper was produced, and then creating a committee of, I believe, 35 people together to discuss this. They were trying to create a racehorse, and they didn't create a camel. They really created a great steed. And you'll see as we go through some of the pictures. This is critical that we see this as a dental home. We see that as a dental home through the life of an individual, and I think that's an important point to emphasize. The faculty, we have had for many, many years a small area where patients with disabilities were treated, but it was too small and inadequate in terms of treating a larger population or providing greater access to care. You can see here, this is pretty interesting, the floor design. It's not a clinic. You'll notice there are 9 regular operatories on the left-hand side, and then I'll show you a little close-ups. There are 2 main procedure rooms that exceed the size of most hospital operating rooms. Ron, Dr. Kaufman didn't have a slide on Ron to my era, but Ron is a pediatric dentist as well as an anesthesiologist. So the level of care that we can now provide in this facility is unparalleled. And you'll see as we go through the pictures, the colors, the design, the spaces are all meant to allay anxiety and to provide alternate methods of providing the top-notch oral health care.
So I think from the slides you can see what we've done here, and what's resonated so beautifully, and in the patient population that we've treated so far, is that we've given this patient population a respectful and dignified place in order to be treated. And it's a place that's been lacking for so many years in some of the dental treatment that's occurred. There have been so many stopgaps in dental care for people with disabilities because nobody wants to treat them. Nobody feels as though that that they can, and we need to change that. So what we did was we visited about 6 or 7 different centers throughout the nation, and I feel like we hired a young architectural firm. The female architect was amazing, and she took my vision of what I saw as in treating this patient population for about 25 years. And as an anesthesiologist, and kind of combined it all together in creating something that I think is epically beautiful. Up on the right is our reception hub, and it's large and inviting for people in wheelchairs, and it really makes them feel as though they have a dental home. That's on the right, upper right is our operating room. I probably the only operating room in New York City with a view of the Empire State Building. So most of my colleagues and my anesthesia colleagues are pretty jealous of the fact that I get to use that OR room. Typical on the lower right is a picture of a standard operatory it's much larger than the traditional operatories. It's inviting to people with caretakers or anybody or parents and family members that come with those patients. And on the lower left is we are one of 24 chairs in the nation that has this wheelchair tipper, which is really amazing because on the lower lower left is the bariatric treatment bench that kind of holds a 650-pound bariatric patient. That comes off that bench, and then we can easily put a wheelchair on and not have to do a wheel transfer and be able to tip the patient and treat them that way. So a lot of the patients that couldn't be diagnosed before or take x-rays before, we can now do that. And it's pretty amazing to see the challenges that have occurred, but the nuances that we have been able to deal with those challenges.
You know, if you've been to your dentist's office recently, you'll notice that the dentist might be, the assistant might be there, of course, the patient, and maybe somebody will be by the doorway. These rooms can easily accommodate 4 to 10 people in the room. And you'll notice, although the fisheye doesn't really show it, 360-degree access, and everything is all the latest digital type of equipment. And the chair, right now our chair, I think, gets the most use of any room in the facility. I'm going to move to that. We do have a system of referrals to get patients in during question and answer. If you have any question about how we access the facility, we can certainly give that to you. But we have a wonderful, wonderful patient care coordinator who actually worked in another area of the medical center, the MyFace Foundation, and she's now with us. Ron is a fantastic recruiter, so in addition to his passion, if you start talking to them, you won't stop. I'm going to go to this part now. I want Ron to talk about this, the multisensory room.
This is not new technology, but what the way our multisensory room is, these are indications, these are products by the Snoozlin technology. This is a company that was developed it's a Canadian company, and this is their technology that they had, and so we had these nice ideas, and then we used the collaborative ability of the NYU students and made our own multisensory room. So when you come and see it, you'll see that it's kind of, some of this is the same, but not all this. The students did a really good job in looking at focus groups of patients on the spectrum and other family members, and really came together as a team approach and made some amazing adaptive equipment. They made some clouds that are colored. We have a vibrating wall. We have a big, huge egg chair with lights in it that people can sit in. So they had about 4 or 5 different prototypes that we made, and then that we had available to President Hamilton when he came to see the center. I think that's what was one of the things that he was most proud of when he came to see the center, was that we utilized the collaborative ability of all the other people within the college, his college, to make something really special. And I think that's something that I'm most proud of as well.
Ron's being a little modest. If you saw the New York Times piece, they interviewed one of the fellows who was treated. He had never been treated in a dental chair before, and he spent some time in the multisensory room, and then Ron performed regular dentistry on him without any, no IV in the arm, just sitting in a regular dental chair. This is amazing, you know, if you've been in this area. Like to say that when architects get involved in doing something for a population like a disabled population, their lives are forever changed in the way they think about new developments. It's exactly the same thing that happened here, especially what's happening with all our dental students. When they leave here, they go to all 50 states. They will be proponents for providing this level of care. In fact, they won't want to be left out and not be able to provide this level of care. So next minute or two, just like to, one thing, we do have many partners, and the number one partner, of course, is Dr. Kaufman, which we're very grateful for. But we did partner with many others that are providing us insight and ongoing advice to do this in the best possible way. So I'm going to stop here formally, unless Ron, did you have anything? And then if anybody, I think we do have time for some questions, and hopefully we can answer them. So thank you very much.